Okay, so now next topic we are going to start antimicrobial agents. Antimicrobial agents means these agents are used against microbes. Microbes means these agents will be used against bacteria, against virus, against fungus, against helminth, protozoas. So in antimicrobial, first we are going to discuss the first topic in antimicrobial we are going to discuss is antibacterial agents. So first antibacterial agents. Remember guys, and all antibacterial agents are not antibiotics. That is a misnomer. We usually say antibiotics. All antibiotics are not all antibacterials are not antibiotics. Antibiotic word is basically different. Antibiotic means the source of the antibiotic. Remember, the source of antibiotic is microbes, and they are used against microbes. So source is microbe, used against microbe, that is antibiotic. Antibacterial means any substance which is used against bacteria, or you can say to kill or to suppress the growth of bacteria, that is called as antibacterial agents. Now there are two type of drug in antibacterial. One is bactericidal agent and the second is bacteriostatic agent. Bactericidal and bacteriostatic agent. In bactericidal and bacteriostatic, bactericidal means kill the bacteria. Kill bacteria. Bacteriostatic means what? Bacteriostatic means inhibit the growth of bacterial colony. Inhibit the growth. Now, bactericidal, they are effective against active. They are effective against active, or you can say the fast growing bacilli. So active or fast growing bacilli. Fast growing bacteria, not only bacilli, even the cocci. So fast growing. So they are effective against active or fast growing. Bacteriostatic, they are not only effective against fast growing, they are effective against all. So this is the difference. So see, bactericidal only and only effective against fast growing. Now suppose you use the bacteriostatic plus bactericidal, what will happen? Bacteriostatic will slow the growth. If slowing the growth, then bactericidal will not be effective. So this is the reason that bactericidal should not be given with bacteriostatic agent. Bactericidal should not be given with bacteriostatic together. So why the bactericidal is not given with bacteriostatic? Because bacteriostatic will slow the growth, and if slowing the growth, bactericidal will not be effective against these slow growing bacilli, slow growing bacteria. So this is important. Next important thing is you can use bacteriostatic with bacteriostatic, you can use bactericidal with bactericidal, but bactericidal with bacteriostatic should be avoided. For the same microorganism, these two drugs will not be effective. If the spectrum is different, you can use them together. But for same one microorganism, these two should not be combined. Then comes to, out of these antimicrobial agents, remember, one is concentration dependent effect. Concentration dependent effect. Second is time dependent effect. Time dependent effect. So one is concentration dependent effect and the second is time dependent effect. In short, you can write CDE. In short, you can write TDE. So guys, in concentration dependent or time dependent, what is the difference? In concentration dependent effect, suppose this is the time and this is plasma concentration. So what will happen? You give the drug, it will cross this level. This is the plasma concentration, which is minimum inhibitory concentration, MIC. So when the drug will cross this MIC level, it will show the effect. So MIC level is very important, minimum inhibitory concentration. MIC means minimum inhibitory concentration. So it will show the effect The drug will show the effect when it will cross the MIC level. Above the MIC, it will be effective. So, suppose there are two drugs. This one is A and this one is B. Now, in concentration dependent, what you have to see? In concentration dependent, you have to see that the maximum concentration of these two drugs. So, you can see the maximum concentration of these two drugs. The B is having higher concentration than the drug A. Don't see the duration, only see the concentration. The concentration of B is more than the A. So, that's why B is more effective than the A, because its effect is depending on the concentration. The second is time dependent effect. In time dependent effect, TDE, again we have to see, this is the graph, this is time and this is the plasma concentration. So, in this again there will be MIC, this is the MIC level, this is the MIC level. What do you have to see in this? In this you have to see that for how much time the drug is above the MIC level. So, suppose again there are two drugs, one is drug A and one is drug B. So, above the MIC level, the drug which is for above the MIC level for more duration from this to this much, and the drug B above the MIC level from this to this one. So, you can see this duration is less than this one. So, guys, the drug A is more effective than the drug B if it is following the time dependent effect. So, two type of drug, concentration dependent and time dependent. If depending on the concentration, this one. If depending on the time, this one. Any example for this? Yes. The example for concentration dependent, higher the concentration means more effective. Very important is rifampicin. Rifampicin. Very important is rifampicin. Other than rifampicin, the second important is you can use the azithromycin. Azithromycin. You can use the aminoglycosides. Aminoglycosides like amikacin like drug. So, higher the concentration, these drugs are more effective. In time dependent killing, the important example is beta-lactams. Erythromycin, clindamycin. These are some examples which are time dependent killing, means more the time above the MIC they will be more effective. Now remember guys, out of these drugs, if the concentration above the MIC, that is required for concentration as well as time dependent both. If concentration above the MIC, they will be definitely effective. But even the concentration of the drug below the MIC and still the drug is showing the effect, that is called as post antibiotic effect. ध्यान से सुनना, post antibiotic effect means concentration of the drug crossed the MIC, the drug is effective. Now it is below the MIC, still the effect is continued. That is called as post antibiotic effect. तो एक बार तो MIC को क्रॉस करना मस्ट है. Once it has crossed the MIC, the effect already occurred. Now the effect, definitely the concentration will be down because the drug is metabolized or the drug is eliminated. Then below the MIC, if it is not effective, it's okay. That is normal thing. If below the MIC, it is also continuing the effect, that is called as post antibiotic effect. So in these type of condition, in concentration dependent effect, post antibiotic effect will be there. Post antibiotic effect will be there. Why the post antibiotic effect is there? So post antibiotic effect is commonly seen with these drugs. Why? Because concentration below the MIC, but effect is continued. And why it is occurring? Because the effect is depending on the concentration. Once it has crossed the concentration, even though suddenly it comes below the MIC level, but the effect will be continued. right? So that is post-antibiotic effect. In time-dependent, below the MIC, the drug will not be effective, right? But nowadays, we also have some drugs which are depending on the concentration as well as time both. So guys, concentration and time. So concentration, time dependent effect. Concentration, time dependent effect. So depending on the concentration as well as time both. Concentration and time both. So in this is again time and plasma concentration. Crossing the MIC level, this is MIC, minimum inhibitory concentration. Now if depending on the time as well as concentration, then what is important? Suppose there are two drugs, one is drug A, one is drug B, then it depends on the area under the curve. It depends on the area under the curve. Drug A is having more area than the drug B. Concentration as well as time, that means it depends on concentration and time both. So it depends on concentration and time both. So it is depending on the area under the curve. It is depending on the area under the curve. Bioavailability. Bioavailability depends on area under the curve. So same. And remember guys, in this also post-antibiotic effect will be there. In this also post-antibiotic effect will be there. So in this post-antibiotic effect will be there. Again, concentration dependent is there. So post-antibiotic effect will be there. What is the example for this? The example for this is fluoroquinolones. The example for this is fluoroquinolones. So quinolones, fluoroquinolones like ciprofloxacin, levofloxacin like drugs. So they are having the concentration and time dependent effect both. So this is important thing in the antimicrobial agents before starting the classification.